So, many inherited disorders in humans are controlled by a single gene. Um, Inherited human disorders can show either through recessive trait inheritance or the dominant trait inheritance. For recessive individuals, they have to receive two recessive alleles are needed to show the disease, and in heterozygous parents are carriers of the disease, but they don't actually show the disease. And so the probability of inheriting um, the recessive trait is higher from parents who are heterozygous. It's also higher um, when there is inbreeding among close relatives, which in a lot of isolated communities and places where individuals may seem distantly related, but they're actually, just several generations removed. It creates higher probabilities of making passing along recessive traits from heterozygous individuals. Now, for dominant inheritance, you only need one dominant allele to show the disease, and unfortunately, if you get it, then all your offspring are probably going to have the disease. So dominant lethal alleles are usually eliminated from the population because if it's something that's lethal, sometimes it can manifest before reproduction, and so it can be eliminated or weeded out of the population. So for example, you can have two heterozygous individuals that can mate and produce offspring, and so this is just showing you that from the heterozygous individuals, a quarter of them will be normal, two of them will be carriers, and then a quarter percentage or probability that their offspring will be born deaf. So for an example, the most common fatal genetic disease in the United States is cystic fibrosis, resulting in the excessive thick mucus secretions in the lungs. So the CF allele is a recessive trait, and it's carried by about 1 in 31 Americans currently. So it's a lot of individuals, a lot of carriers, a lot of heterozygous carriers in the United States. There are dominant human disorders which include achondroplasia, which is dwarfism. Another example is Huntington's disease, which is a very sad degenerative disorder of the nervous system and degradation of the brain, which happens fairly early in life, but usually after reproductive stages, and so it is actually passed along to their offspring. And this is just a summary of some of the different recessive and dominant disorders that are common throughout the United States and in human society in general. And you can see the incidence of these disorders. So for cystic fibrosis, there is 1 in 2,500 chance that a Caucasian individual will be born with CF. Phenylketonuria, PKU, which is the accumulation of phenylalanine in the blood, that's 1 in 10,000 individuals. And that is very common. I mean, PKU here, for example, is in soft drinks, and so if you drink that, you can actually build up the phenylalanine in the blood, and so it will actually cause damage. Sickle cell disease, 1 in 400 in African Americans. And then there's dominant disorders. We know Alzheimer's disease is a dominant disorder, but we don't know the incidence of this, at least not yet. Hypercholesterolemia here, excessive cholesterol in the blood, 1 in 500 of the heterozygous individuals. have that. And it's just an example of one of a physician here who has dwarfism. And so even though you may have the disorder, genetic disorder, it's not, in many cases, it's not something that is debilitating or ending your life. It just, these are all problems that people have and can inherit. You just have to overcome them. And one way you can overcome these things is actually to test to see if you are a carrier, if you are a heterozygous carrier. So there is technology that can be used to obtain genetic information from before conception, during pregnancy, and after birth. So genetic testing can determine if you are a heterozygous carrier for a certain disease. And there's several technologies that can be used to test for genetic conditioning in a fetus. Amniocentesis extracts samples of the amniotic fluid from the placenta and obtain cells to use for karyotyping. So you can karyotype your fetus to see if they have inherited any traits or conditions that you may need to know of, such as Tay-Sachs disease. There's chorionic villus sampling, or they call it CVS for short. Removes a sample of the chorionic villus tissue from the placenta, so that you can also do the same thing, do a karyotyping and use biochemical tests. And so this is just comparing these two fetal tests, where I guess depending on who you ask, I don't really know, quite sure. I've heard arguments for both, which one is more invasive. But you'll notice here that taking the amniotic fluid, they do use a large needle to go in and take the fluid out. And you can see it can take several hours to several weeks to get a biochemical or genetic test compared to CVS testing, where you can see how you have to go in through the all the way into the uterus and the placenta, where they will take a sample of the chorionic villi here. And then this is actually a very fast test. It takes just several hours to get a karyotype. The biggest difference though between these tests, CVS sampling can happen at a much younger age, a younger fetal development, compared to the amniocentesis test, which is just something that happens much later when the fetus is more developed. Because if something is wrong at a much earlier stage, there are instances of individuals who inherit genetic problems where could be life-threatening to the mother, or it could just be life-threatening to the fetus as well, where they will determine if it's better to abort or do some other procedure to save the mother, or something to, or do a procedure to save the fetus as well. There are surgical procedures that they do now on fetuses and fetal development that are possible. So blood tests on the mother at 14 to 20 weeks of pregnancy can help identify fetuses at risk for certain birth defects. And then another way of doing this is there's also fetal imaging, which is ultrasound imaging, where you use sound waves to produce a picture, and they have 3D imaging now. You can actually 3D image a fetus to see if there's any problems while it's developing. Yeah, and so we want you to take a problem or a disease. It can sometimes be prevented either by special care or precautions, or sometimes it may include fetal surgery, as I mentioned earlier. And this is just an example of a mother who is getting an ultrasound by her caregiver. And so new technologies do raise ethical questions and considerations. For example, confidentiality and potential use of results of genetic testing. For example, should insurance companies get the results of a genetic test? Time and financial costs, where for more wealthy individuals that they have more time and they're able to afford to do these tests compared to lower class individuals who may not financially be able to afford genetic testing, where they may need to because they may be carriers, heterozygous carriers of a certain traits that could be harmful to the mother or to the child. And so having time and the money to do genetic testing could end up saving that child's life. And then determining what, if anything, should be done as a result of the testing. It very possibly could be a day where a genetic test could determine if you are, say, have a pre-existing condition or not. And is that ethical? I don't know. I'll let you guys think about that for yourselves.